everybody. We are less than 24 hours away from the Susan G. Komen Polk Race for the Cure. It's a cause that holds extra special meaning for us at ABC Action News. Our own Linda Hurtado is a breast cancer survivor, and the race is so much more than just a community event. It's an important source of funding for local programs that are saving lives. Take a look.
Hi, Ms. Cheshire. My name is Rachel. I'm going to be doing your mammogram today.
Rachel Garner is a mammogram tech at the Watson Clinic Women's Center in Lakeland. She's done literally thousands of mammograms.
On any given day, one particular technologist, we could do over 20.
Even though Rachel was only 33 and she knew her insurance wouldn't pay for it, a nagging desire to get her own mammogram wouldn't go away.
Usually you don't have your first mammogram till anywhere between 35 and 40. Working here, I see this day in and day out. We do occasionally diagnose some very young patients.
So her doctor wrote her a prescription. This is Rachel's mammogram, and this spot turned out to be breast cancer.
Are you seeing younger patients or perhaps just diagnosing them younger because of the better technology?
I think it's awareness and technology. I think more women are self-aware, self-breast aware, paying attention to their own bodies, and therefore they are seeking attention sooner.
Rachel underwent a bilateral mastectomy and chemotherapy and is now cancer-free. Now, if she had waited until she was 40 to get that mammogram,
she could have had stage 4 disease that wouldn't have been necessarily survivable. So it's a huge, big deal that she found it when she did.
Dr. DuPont says the message women should take away from Rachel's story is,
it's follow your instincts, pay attention to your body, and know that you will be okay.
And joining us in the studios with more, we have Eva Hawkins, who is with the Think Pink We Care of Polk County. Thank you so much for coming in. You all are one of the recipients, the only recipient of the in Polk County. Tell us what that means for you and the different programs that are in place.
Because of the grant from the Susan G. Komen Florida Suncoast affiliate, we're able to provide screening mammograms for low-income, uninsured women in Polk County, and then also other breast-related health services. So if a screening mammogram came back positive for something, we would be able to follow up with a diagnostic mammogram or possibly a biopsy if that was needed.
And just a few moments ago, you were talking about how many cases you were able to diagnose this year. Share that with our viewers.
This year, we were able to find 9 cases of breast cancer.
9. Wow.
It's a significant impact, and when we looked at it in the past 4 years, we had a total of 16 cases. So this was extremely high for us, and we felt very blessed to be able to have that type of an impact on our community.
When we have someone like you come on and talk about how funding is so important to keeping these programs alive and helping patients, it helps to show the other side of what this community race is all about. What's your message to folks out there who haven't decided yet whether or not to come out?
I encourage them to come out because this is really caring about your neighbor, because there are so many women in Polk County that are falling into that working poor where they do have jobs, but they're not able to receive a mammogram and go and get that. And so it's because of this race, the funds that are being generated and raised, that we're able to continue to provide those mammograms for people.
Thank you for coming in, Eva, and we will see you tomorrow bright and early. Remember, you are invited to join us at the Polk Race for the Cure. The races start at 8 a.m. tomorrow, and Linda Hurtado and our team will be there to say hello.